Hi everyone, today we're going to go over anatomical planes and sections. So, anatomical planes and sections refer to the way things are cut or divided. Okay, so we often use them when we're talking about injuries, surgery cuts, or dissection cuts. So, we're going to go over the major different terms for planes and sections found on the body, and then we'll go over some examples so you get an idea of what those things are. Okay, so an anatomical plane or section is the way we divide the body or its parts into different sections. So it's a little bit confusing. I'm using the word planes and sections for description purposes. But basically, we use plane for the imaginary line we can kind of break down over an image. So, the X, Y, and Z plane, think of it like that. But if I'm actually going to make a cut along something, then or divide something into two halves or slices, then I'll say I'm going to make a section of them. So sometimes we'll use the word cut or make an incision along this plane. I could also use section, just make a section on this direction. Okay? So it's very helpful when performing surgeries or treating injuries. Okay? And we'll go over this example later on when we go over what these terms mean. But on the interior side of the chest, so on the front side of the chest, intermediate, so remember intermediate means between. So intermediate of the two pectoral muscles, you're going to make a 2-inch sagittal cut. And that's going to create a different type of cut than if someone said you're going to make a 2-inch transverse cut. And we're going to go over those two terms later. Okay, so what's sagittal? Sagittal is a cut that divides between the left and right side. So you have your left, you have your right, and then you're going to make a cut that splits them into left and right sections. Okay? So, in this case, when you do a sagittal cut, you kind of create sort of a silhouette effect. So, so we call that a sagittal plane cut. Now, depending on the weight, so this is sort of a image at Body Worlds of a sagittal cut. So, if you cut directly on the midline, so it's equal left and right sides, then we call it a mid-sagittal cut. However, if it's a little bit off, then we're going to call it a parasagittal cut, which misses the midline, but still going to be between a left and a right side. So I'm just going to kind of sketch it out so you get the idea. So if I were to cut something right down the center in half, this is what we call mid-sagittal. But if I cut it's still in the same direction. So it's still parallel to the cut, but it's off like this. So if I cut along that line, this would be a parasagittal cut. Okay? That's all that means. So it's still cutting down in the same direction, but the difference here is just how close it is to the midline. Okay, frontal and coronal cut. So frontal means, you have a front. So it actually cuts so that your front side is separate from the back side. So you're cutting along that plane. So it separates your ventral from your dorsal side. So in this case, this plane over here, that's highlighted here, that's a classic example of a frontal cut. So you end up with like a silhouette like this. So this is an image at Body Worlds of a frontal cut. Okay, so you kind of get the outline of the person's silhouette almost from facing frontward when you do a frontal cut. So usually going to do this if you're trying to make a cut on someone's skull, cranial, like head area, or maybe if you want to make a cut on like the side of their torso off to the edge, then this is a good terminology you might want to use for a cut. You'll say frontal or coronal. Now notice I use the term ventral versus dorsal, so back from belly. So this actually means my terminology is going to be different between my dog and my human. So in this case, for the human, from the ventral from dorsal, so my belly from my back, I'm going to be cutting like this or like this, but any direction along this line so that my eyes are separated from my back. That's a frontal cut. But my dog has their ventral side down here and my dorsal side here. So a cut that separates the two would actually be along this line here. So that's a frontal cut on a dog. So this is frontal. This is a frontal section or plane. Okay? And it could be anywhere along, but it needs to be parallel in that same direction. These are all examples of frontal cuts. Okay. Transverse cut. So a transverse cut separates superior and inferior in humans, or if you were to apply it to both humans and dogs equally, then we will say from caudal from cranial. So your head from your tail. Okay? So in this case here, transverse is going to pretty much always create circles. It's kind of gross to refer it to this way, but it helps me. It looks like a ham slice after you cut someone along that plane. So this is actually an image of a cadaver cross-section. So we use the term cross-section when we're referring to creating those circular cuts on a kind of a perfect circle. All right. So if you cut along that line, that means for a human, the transverse cut is this way. And it could be anywhere along that direction. These are transverse cuts. But for a pig or dog, it would actually, the circular cuts would be if you cut them this way. So this is transverse on my pig in this example. Okay? So it would basically create those circular sections. So again, transverse on a human, transverse or horizontal or cross-sectional on a dog. Okay? And when we say something is a cross-section, we're specifically referring to the image that circular image you end up when the tissue is sliced. So it looks like circular ham. Sorry. It's a gross thing, but it does really help you memorize it. Last special term for a cut is called oblique. Oblique just means not along a straight line, right? So if you notice, all the lines we drew earlier for for frontal, sagittal, and transverse, all of those are at right angles. They're either, they're straight across, straight up and down, or front from back. Oblique just means at a weird angle. It just means slanted. All right, so obliques are at odd angles. So that O for odd angle. And hopefully that helps you remember. So all of these lines here are examples of oblique cuts. So just any cut that's off at a weird angle, that's oblique. All right, so that's just a quick overview of the various terminologies we use for anatomical planes and sections. Here are alternative images to help you remember or be able to refer to the different ways these planes or sections are cut along the line of. And if we think about it in terms of examples, right? So I identified on the front side of this person. So this is a front view. We want to go between their two pectoralis. So pectoralis means pecs. So between here and here on this person, I want to make a cut. Now, so between the left and right pec, a 2-inch sagittal cut, right, would actually be here. In fact, that's a mid-sagittal cut because it's right between the two pecs. So that'd be a sagittal cut because it's separating left from right. However, if I were to do a transverse cut, on the other hand, then transverse, remember, has to go ham-wise like that somewhere. So it's going to cut them between the pecs. I would make a 2-inch cut like that between the pecs, and that would be a transverse cut. Okay? So that's the way it's used in dissections or surgery to help indicate the direction things should be sliced. Here are some other images along those planes to help you identify them. All right, so takeaways. Planes and sections allow professionals to communicate how to treat patients or dissect and study other organisms. Medicine has many terms for incisions and cuts, and there's actually more than just these terms, but our class just goes over the basics: sagittal, frontal, transverse, and oblique. There's actually way more terms than that, but we're not going to go over them. Parasagittal and mid-sagittal refer to their relationship to the midline, right? It's left and right cuts, but mid-sagittal is right on the midline, and parasagittal is any left-right separation cut that is not quite on the midline. And finally, transverse and frontal coronal planes, they're going to be unique between humans and four-legged animals. That concludes your notes for the day. Move on to whatever else work you have. Bye.